impact all aspects of a person's life, including physical, socioeconomic, and psychological. Chronic low back pain affects approximately 15 to 45% of the population and is a frequent disability for the adult population. As a clinical nurse specialist and the director of the Integrative Multimodal Back Pain Clinic, the mission of our clinic is to improve quality of life for patients suffering from chronic back pain. Our goal is to provide a patient-centered care treatment approach to chronic low back pain so patients can better manage their pain. Recent studies suggest that the use of pharmacological treatment for chronic back pain, particularly opioids, is not recommended due to side effects and the risk of addiction. And a multimodal approach for chronic low back pain is recommended. Our clinic's multimodal approach provides clients with alternative treatments based on a biopsychosocial complementary care process, including non-pharmacological treatments such as nutritional therapy, physical therapy, behavioral therapy, and pharmacological treatments such as oral and topical non-opioid medications, spinal injections, and surgical management referrals. Because pain is different for every individual, our team provides clients with an individualized pain plan. These professionals include nurse practitioner, registered dietitian, physical therapist, licensed clinical social worker, and clinical nurse specialist. Team members will collaborate interprofessionally to develop an evidence-based plan of care geared to the client's pain management needs. The patient and team meet face-to-face initially and throughout the treatment plan to assess progress and outcomes. Telehealth or virtual meeting options are available. As director, I am passionate about our clients receiving personalized care. Chronic low back pain is debilitating and can impact all aspects of a person's life, including physical, socioeconomic, and psychological. Chronic low back pain affects approximately 15 to 45% of the population and is a frequent disability for the adult population. As a clinical nurse specialist and the director of the Integrative Multimodal Back Pain Clinic, the mission of our clinic is to improve quality of life for patients suffering from chronic back pain. Our goal is to provide a patient-centered care treatment approach to chronic low back pain so patients can better manage their pain. Recent studies suggest that the use of pharmacological treatment for chronic back pain, particularly opioids, is not recommended due to side effects and the risk of addiction. And a multimodal approach for chronic low back pain is recommended. Our clinic's multimodal approach provides clients with alternative treatments based on a biopsychosocial complementary care process, including non-pharmacological treatments such as nutritional therapy, physical therapy, behavioral therapy, and pharmacological treatments such as oral and topical non-opioid medications, spinal injections, and surgical management referrals. Because pain is different for every individual, our team provides clients with an individualized pain plan. These professionals include nurse practitioner, registered dietitian, physical therapist, licensed clinical social worker, and clinical nurse specialist. Team members will collaborate interprofessionally to develop an evidence-based plan of care geared to the client's pain management needs. The patient and team meet face-to-face initially and throughout the treatment plan to assess progress and outcomes. Telehealth or virtual meeting options are available. As director, I am passionate about our clients receiving personalized care, and I work closely with the care team to ensure positive treatment outcomes.
Hello, my name is Mary Ann Chedmont. I'm here today to discuss with you my role within the clinic as a family nurse practitioner. Chronic low back pain is defined as lasting more than 12 weeks and is associated with increased healthcare costs, decreased productivity, and increased clinician visits. Therefore, the goal of treatment of chronic low back pain by the nurse practitioner within the clinic is to evaluate the patient, perform a complete history and physical, and establish a non-invasive treatment plan of care. This treatment is outlined and congruent within the standards of practice of nurse practitioners outlined by the American Association of Nurse Practitioners. Following a diagnostic exam, a treatment plan is developed that focuses on a reduction or elimination of low back pain, improvement in health-related quality of life, pain relief, improvement of function, decreased loss of work, and increased patient satisfaction. Initial treatment options should include non-pharmacological treatments such as exercise, TENS units, back support, biofeedback, exercise, acupuncture, multidisciplinary rehabilitation, mindfulness training, yoga and Tai Chi, motor control exercises, progressive relaxation, and most importantly, patient education. If non-pharmacological methods are unsuccessful or need to be combined with medication, then non-opioid medications are recommended. These include acetaminophen for short-term use only, or traditional NSAIDs such as naproxen, which carries a low risk of cardiovascular events and improves pain. If additional medications need to be introduced, medications such as muscle relaxants and antiepileptics can also be introduced to the patient, as well as spinal injections. If these medications are not successful, then referral for possible surgical intervention may be necessary. Thank you for the time, and we hope you enjoy our clinic.
Hi, I am Monique Barrington, and I am a certified physical therapist. My role in the Collaborative Alternative Pain Management Clinic is to provide guided, evidence-based therapy to improve and restore your physical abilities. Physical therapy is often recommended for the treatment of persistent and/or chronic pain. Studies suggest that exercise reverses the neurological changes that occur at the time of injury. There are 4 prospects for which I will focus: manual therapy, trunk coordination, strengthening, and endurance exercises, progressive endurance exercises and fitness activities, and lastly, patient education and counseling. I look forward to assisting you with managing your pain and optimizing your physical mobility.
Hello, I'm Denise Chernitzer, and I'm going to talk to you about the role of the social worker in the multidisciplinary clinic. Professional social workers provide services to. I'm going to talk to you about the role of the social worker in the multidisciplinary clinic. Professional social workers provide services to individuals and families throughout the lifespan, addressing the full range of biopsychosocial, spiritual, and environmental issues that affect well-being. Hallmarks of social work's commitment to health and well-being is the profession's continued focus of the issue of healthcare inequality in the United States. Social workers help facilitate healing opportunities for healthcare consumers through support, understanding, knowledge of conditions, and awareness of resources capable of offering support. Social work, with its tradition and commitment to social justice, respect for persons, advocacy, empowerment, has the opportunity to embrace issues reflected in the complex questions that relate to pain management. Vast disparities are evident in the care of persons with pain. The Center for Disease Control and Prevention identifies race, ethnicity, religion, socioeconomic status, sexual orientation, gender identity, age, mental illness, cognitive, sensory, physical disability, and geographic location as being linked to discrimination or exclusion of health care services. The National Association of Social Workers Code of Ethics elaborate on the 6 ethical principles related to service, social justice, dignity and worth, human relationships, and integrity. Chronic non-specific back pain is a leading cause of disability that impacts the individual, the family, and the community. The social work model of care is congruent with efforts to move beyond the medical model to a multidimensional focus. With the integration of complementary and alternative medicine, social workers help individuals identify care providers that offer these therapies and resources that are available. Specialized knowledge of issues such as disease processes, healthcare systems, healthcare trends, community resources, and the impact of acute, terminal, and chronic illness on the quality of life are essential to the role of the social worker in healthcare.
Hello, my name is Tarinda Austin, and I'm the registered dietitian for the primary care practice. As part of the multidisciplinary team, it is my responsibility to ensure that our patients are well educated on proper nutrition and managing their chronic back pain. Nutrition, exercising, and maintaining a healthy weight plays a key component in improved healing. Nutrition is an important building block when developing a plan of care for managing chronic back pain. It is important that the correct foods are chosen for optimal health. A balanced diet with the variety and the right amount of vitamins and nutrients are essential to reduce back pain by nourishing the bones, muscles, and structures of the back. A healthy diet of lean proteins, raw and/or steamed vegetables, raw fruits, nuts, seeds, and plenty of water supports overall improved health, healing, and decreases inflammation that contributes to pain. It is important that I educate my patients to avoid foods high in sugars, foods high in fat, simple carbohydrates, caffeine, and starches, as these increase body fat composition, which increases pain and pressure on the back. Proteins contain all the essential amino acids needed in healing. Some examples of foods high in protein are lean chicken, fish, eggs, low-fat cheese, cottage cheese, and yogurt. Calcium and vitamin D are also nutrients that are very important when healing is involved. These two nutrients support bone health. The best sources are low-fat dairy foods, milk, dark green leafy vegetables, and some fish. Fiber is also very essential for healing. This is because some pain medications, usually opioids, contribute to constipation. Fiber is very important because it helps reduce and/or eliminate constipation. Some foods that are high in fiber include prune juice, oats, peas, and berries. Again, it is also very important to increase the water intake as this can also help with managing constipation. Fiber supplementation may be necessary as it may be very hard for some patients to get in the amount of fiber that they need from the foods they eat. Some other nutritional supplements that are known for contributing to reducing inflammation and relieving chronic pain are a multivitamin. Most vitamins, they work synergistically together, so it is very important to take a multivitamin. This way you'll get all the nutrients and vitamins that you need in one capsule or one pill. Glucosamine and chondroitin, these are found naturally in the body, and they can also be taken as a supplement. They help prevent joint and tissue breakdown, thus decreasing pain and inflammation. Digestive enzymes, they help break down foods, improving digestion and making the nutrients readily available so that your body can use those as energy that can contribute to healing. Systemic enzymes, they work outside of the colon and they help break down protein. They also help they also help to heal scar tissue throughout the body, which improves the blood flow, thus decreasing pain again. And some herbs known to decrease inflammation are turmeric, ginger, boswellia, willow's bark, and capsaicin. So again, it is very important that we educate our patients on taking in the right nutrients and supplements to help manage and relieve their chronic back pain. Thank you.